My name is Marissa Brooks. I am the head of video content and communication for Pills. And today I am talking about everything residency with Maya. Go ahead and give yourself an introduction.
Hello, everyone, and thank you for having me, Marissa. My name is Maya. I'm currently serving as the director of the Pills Protege program for the clinical/residency side of things, and I also serve as a PGY2 Ambulatory Care Pharmacy Resident at the DeBakey VA Medical Center in Houston, Texas. So happy to be here today.
You're a superstar. I'm happy to be talking to you. All right, so to get started, what is a pharmacy residency?
Yes, of course. So a pharmacy residency is 1 or 2 years of intensive clinical pharmacy training where you're working under a preceptor to train to become a clinical pharmacist. So dealing with patients in direct patient care, and the opportunities are actually very endless for what you can do. So specifically for a PGY1 residency, it is more of a generalized pharmacy training experience where you're training in both inpatient and outpatient pharmacy experiences. So for example, internal medicine, you'll have a variety of those rotations, as well as different ambulatory care or clinic-based rotations. And then if you go on to pursue PGY2, you have the opportunity to specialize in ambulatory care, so that I'm pursuing right now, or there are other opportunities like infectious diseases, solid organ transplant, and there are really so many different opportunities for you to become a specialized clinical pharmacist and be the pharmacy expert in your field.
It's exciting. Oh my gosh. I guess you kind of mentioned it a little bit, but like, what are the different types of residencies?
Yes, so as I mentioned, PGY1 is really for you to be trained as a general clinical pharmacist. You're able to pursue clinical pharmacy roles, and really you're kind of like a jack of all trades. You're able to train in both inpatient and outpatient experiences. And then PGY1 qualifies you to be able to apply for PGY2 or a second year postgraduate year 2 residency, where you're able to specialize in different fields, as I mentioned before, to really become an integrated specialized clinical pharmacist. And then we also have combined PGY1 and PGY2 residencies. And the one that really comes to mind that's very popular is health system pharmacy administration and leadership residency, where this is a very specialized opportunity for you to not only train as a clinical pharmacist, but for you to be trained under specialized managers and preceptors and eventually go on to become a pharmacy manager. You may even become head of a pharmacy department. And so that is a very specialized experience. And there are also other PGY1, PGY2 combined residencies, such as pharmacotherapy, where you can more so specialize in academia, and other more broad opportunities.
Awesome. Do you have to be an intern at a hospital to get a residency? This is a question that I've gotten, and I'm sure you've gotten it multiple times as well.
Yes. So that's definitely something that comes up quite a bit through talking to different P4s, even P1 through P3s. And the answer is no, you do not have to intern to be qualified for a residency. Although this would be a great experience to get you experience in the workflow of what inpatient pharmacy is like. And it may make your resident rotations a bit easier to transition to once you begin staffing and working in the pharmacy on the weekends. But you can definitely have different outpatient pharmacy work experiences, like working at pharmacy retail chains, volunteering in different maybe independent pharmacies, or even shadowing pharmacists in different areas can all be different ways that you can integrate those pharmacy experiences. But definitely do not feel bad if you don't have hospital pharmacy experience.
Yeah, it's important to kind of like play off of those other experiences that you have and talk about how you can, use those skills into the like residency type of role.
Yes.
What would you say makes you a competitive candidate for a residency program?
Yeah, so that's a good question. You're going to segue from the previous question. So I did mention you don't have to have pharmacy, like hospital pharmacy specific experience. But like I mentioned, it's good to have a variety of different pharmacy experiences, whether that was working as an intern in retail pharmacy. Although work experience is not required, a solidified requirement for residency. A lot of the things that are emphasized are leadership experiences. So if you're involved in pharmacy organizations, just to name a few like SNAFA, PLS, ROCI, different pharmacy organizations like that, and having leadership positions and not just being a member of those organizations. So showing that you have initiative, showing that you're very involved and passionate about furthering pharmacy as a whole. Leadership is definitely one of the most important things in having on your application. But also having research experience, although not required, but it will definitely get you a step ahead with having research with various pharmacy professors, different preceptors that you have, and just showing that you are able to successfully collaborate on projects and bring out a solidified and amazing project at the end would definitely make your transition into residency easier. As I mentioned, having those work experiences do help you, but are also not required. But also having, applying for different scholarships, awards, really showing that, as I mentioned, that you have initiative, you're very involved and passionate in the pharmacy career as a whole, are definitely things that will get you a leg up with residency and will also not only get you a leg up there, but will give you good experiences to talk about in your interview and to show that your pharmacy experience has been rewarding and that you definitely have learned something that you can take into residency with you.
That's great. And another question I hear a lot is, do you have to have a high GPA to apply for residency?
Yes, so the answer to that is no. You do not have to be the perfect 4.0 student that's got straight A's on everything. And as we know, pharmacy school is a challenge. And so programs definitely do take this into account. And so usually the GPAs that programs begin considering in this is not program specific by any means, but anywhere from around 3.2 is where programs begin to look at candidates there. But again, that is really just a generalized number that is thrown out from time to time. But no, you do not have to have straight A's, 4.0. It's best that you have, like I mentioned, those leadership experience to supplement your grades if you don't feel that they are as strong as they could be. But as long as you have that passion and are able to speak to your experiences, that definitely outweighs the possible 4.0 student that doesn't have any pharmacy organizations for sure.
Yeah, absolutely. It's good to be a well-rounded candidate for sure. What does the residency application and interview process look like?
Absolutely. So the residency process, recruitment for programs usually begins around the fall time. So starting actually around this time, around August, September, programs begin to hold informational sessions for different candidates before students to really look into the program, talk to the residents, talk to the preceptors, program administration, just to get a feel for the program and see what they're like. Once that begins, candidates usually start to develop their CV or curriculum vitae, as well as their letter of intent. And start to kind of decide what programs they want to apply for. After that, around the beginning of November, the forecast application opens. And this is really a portal for students to apply for multiple residency programs at the same time if they are ASHP accredited. And so this is really an all-in-one place for candidates to designate which programs that they would like to apply for. You're able to pay your fees, you upload your school transcript, as well as any letters of recommendation and any other supplemental information that the program may require. And then from there, you apply through the forecast program. Of note, it is about $110 for the first 4 programs you apply for, and then afterwards there is a fee per program for you to apply. Around December, late December, early January at the latest, applications close through forecasts. And so any program that you apply for, the deadline's passed for that. Interviews begin. Programs will either sometimes send you a pre-interview before your actual interview starts, whether in late January, early February. Sometimes you may have a phone interview just to screen out potential candidates. And then around February, March, you may even have an on-site interview. And with COVID, things have changed a bit, but sometimes some programs hold on-site interviews. Pre-COVID, everything was on-site interviews, but now a lot of the scene is switching to virtual interviews. And so this virtual interview process whether on site or virtual, may last anywhere from about 4 to 6 hours throughout the day. You're meeting with program preceptors, program leadership, residents to interview you, maybe clinical cases, different things to work on to show if you and the program would be a good fit. And then around mid-March, around mid-March, April, match day comes around. You find out if you match with the program. And then from then on, you begin your residency program in late June, early July.
Awesome. It's a long process. That's awesome.
Yes, absolutely.
Very exciting though. Okay, I do have a bonus question for you. Being that you have done the PGY1, the PGY2, what's your favorite thing that you've experienced in your residency?
Oh, that's a good question. I would say my favorite thing, so I do work at the Houston VA. I would definitely say really getting to track the progression of caring for my patients, getting to see my same patients over and over again, even patients that I've seen last year, and getting to establish those connections with them, really learning about their life, learning about things that they've gone through and ways that I can help them as a pharmacist. I would definitely say I've enjoyed residency in many different aspects, but getting to know my patients and working with them has definitely been the most rewarding thing ever. And it's an honor to be able to serve our country's veterans as well.
Oh, that's so exciting. I love that. Well, congratulations on everything. And it's been really nice talking to you today. I can't wait to see everything that you accomplish in the rest of your residency and onto your career. So thank you so much for speaking with us. And I will talk to you a little bit later.
Great. Thanks for having me, Marissa.
Thank you. Bye.